Let's head to my colleague, Vanessa Poonah, who is in the Western Cape, standing by then with the MEC of Health in the province. Vanessa, it is a harrowing situation. First 2 deaths now. We're hoping it becomes a little bit more serious and South Africans take heed of the call to stay home.
Indeed, a harrowing experience, having to report that 2 deaths have now occurred, not just in South Africa, but indeed in the Western Cape, here in Cape Town. Of course, the call cannot be made strong enough for people to please adhere to government's regulations of this lockdown. These 2 deaths come on the first day of this 21-day lockdown. And I believe I can tell you, if people are not taking things seriously right now about social distancing, if they are not taking things seriously about not leaving their homes unnecessarily unless approved to go to a pharmacy or to buy the very bare essentials, if people are not sanitizing or washing their hands with soap and water every 20, or rather for 20 seconds as a minimum, then I really don't know when South Africans will get to that point where we understand that this is not a joke, this is indeed serious. People's lives are at risk, and already we've lost these 2 people. But I'm going to speak to the health MEC now, Noma French Mbombo. Dr. Mbombo, I'm standing quite a bit away from you to also practice social distancing and to demonstrate how it should be done. But Minister, a very sad situation today, 2 people having passed here in the Western Cape. Please, can you give us some information? We understand one was in a private and one in a public hospital. What further information do you have on these 2 patients right now?
As the Western Cape Department of Health, we want to pass the condolences to the families. May their soul rest in peace with the 2. At this stage, we don't have much of the details because this team is still busy with that. But as the Premier statement indicated, it's a 28-year-old and a 40-year-old. Ideally, we wouldn't want to go into specifics in terms of which facility, because there will be people who might be dying out of the facilities. The other case, it still needs a confirmation from the National Institute of the Communicable Disease, because although the person presented with the symptoms, and clinically speaking, the doctor confirmed that she might have it, but because it needs some lab confirmation, so that's where things are. We want to urge, and certainly as you indicated, that it's the day that is supposed to be locked down. But there are people who have been sending me pictures where you'll find that people are roaming the streets everywhere. I think for today, it's about hitting the reality that COVID-19 is here, and then we are the first casualties around that. Hence, we still urge the people in terms of the social distancing, in terms of the hygiene, but most importantly, the President's call on the lockdown, because the reason for that is about to protect the public. Like we are now here in one of the clinics, because I'm staying not far from here because I'm part of the lockdown, although I am essential service. I'm running around. What is important is about where we manage to decongest the clinic so that people can be able to pick up their medication in the nearest places, for example, in the community halls, for those people who are not ill, and also for those who present with the symptoms. If they are staying in this area, as you can see here, there is a contact that is the nearest place where people can go and test if they've got the symptoms. If they've called first the hotline, they could go to that area. So to the Western Cape people and also to the South Africans, we still appeal to you, please, 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 self-isolation if we have been tested positive.
One very quick question, Minister, and then we have to go. At this point in time, the public hospitals in the Western Cape, seeing that the 2 cases are reported here, can you give us the assurance and the guarantee that there are no other surgeries or other treatment happening at hospitals? Because at this point in time, we understand that globally there is a challenge with shortage of respirators and so on. Can you paint us a picture? Yeah. Especially we've got a COVID-19 hospital here in the Western Cape.
Yes. The Premier made a statement yesterday, and also went alive in terms of that. All the hospitals, we have done some mapping and the plans in terms of what will envisage in terms of the bed plans, how many beds we'll need, plus also what are the other facilities that we may end up using, like in halls, like a CTICC and all of those, when we are in need of them when it comes to that space. So we already have the plans up to the time that we'll find that we might have the worst moments, or even if there's the lowest moments. So we're working around that. But again, all the 52 hospitals in the Western Cape, they are functional. So a person doesn't have to come all the way to the Tygerberg in case of those. But at 2 o'clock, there will be the statistics that now have been compiled overnight, which the Premier will release, where you can be able to know now how many hospitalized up to now, how many were in ICU, and how many cases. At the time that I was here, it was confirmed that we have got about 229 cases. Of course, we get data from the national department. Sometimes they already have, they'll be advanced having the data, which sometimes there's a discrepancy.
Thank you very much, Dr. Norma French and Mbombo, of course, the Health MEC here in the Western Cape, speaking to us as South Africa realizes today that 2 deaths have already been reported in the Western Cape.